And good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute and Deuk Joint Institute. I'm sitting with a patient of mine from New York, and he came down to Deuk Spine Institute. He's been having back pain for years. He had a microdiscectomy 20 years ago. He's had back pain on and off and just sort of managed it, but in the last 2 years, I guess it's gotten pretty bad. So he had his Deuk laser disc repair done yesterday. We also fixed his SI joints with our Deuk plasma rhizotomy. How do you feel today?
I'm feeling no pain, which is, I'm trying not to get emotional, but it's been a long, hard road with my back over the years. And comes and goes. The last 2 months have been pretty dark, just with sleep and, not being able to do what I want to do with my kids and just battle through all that. So to be able to be sitting here and not have the pain I had yesterday, it's honestly a miracle. And I did a lot of research finding doctors, and actually where I'm from in New York, they offered a fusion or a disc replacement or a spinal cord stimulator, and all those
very common for patients to be offered those options today.
Yeah.
And none of them are necessary, and none of them even work well.
Yeah, and if I had a fusion, I'd be in bed right now on painkillers. And
oh yeah?
Yeah.
You're hoping.
Wouldn't have a good prognosis.
Yeah. There's a small chance of you can die during fusion. It's not a high, but probably around 3% of patients have serious complications, and they're not even going to recover. So I'm glad you avoid invasive surgery, and you chose the best surgery in the world for you.
Yeah, to come all the way from New York is a trip, but when you meet a doctor, I think everything you guys put out is very educational. You learn exactly what the process is going to be, and the only pain I have is just from the incision, and that's like a bee sting compared to what I've been dealing with on a daily basis.
So your pain you've had for the last 2 years is gone?
It's gone right now, which is hard to believe.
But we don't have you on any medication. No pills. Some people say, oh, well, you still have anesthesia. No, you don't.
Yeah, no.
Anesthesia is gone after a few hours.
Although the nurses said I was pretty funny getting up from anesthesia yesterday.
Yeah, you were. We won't talk about that. But that's you, and everybody responds a little different. But the anesthesia is gone. You're on no painkillers.
No.
And your pain in your back is gone.
Yeah, it's honestly a miracle, and I look forward to getting back to some of the activities that I've loved to do in time.
And you probably watched a lot of testimonials of people sitting in that chair right there, hundreds of them, I'm sure. And now here you are, one of them.
Yeah, and I think that's so important that you listen to people and their stories and what they've been through. I always said it'd be easier to just be diagnosed with cancer, and then people would really take what you're going through seriously. I think people who have back pain, it's such a, you're just walking in silent pain every day, and people can't understand what you're going through, and then, the self-medicating, and, you just go down on a bad path.
We at Deuk Spine understand what people are going through with chronic back and neck pain, and the most important thing is we can diagnose the source and we can cure it. There are 30 different causes of back pain that are common. The most common are discs. Discs are the number one reason people have back pain. And it's a tear in the back of the disc. And that's what you had, 2 of them. And we went in with the endoscope and laser. We found those tears, and I used the laser to clean out the inflammatory tissue causing your back pain. You also had the third most common cause of back pain, which is the sacroiliac joint pain.
Right.
And we did the Deuk plasma rhizotomy, destroying the pain nerves, and that pain is gone today. Isn't that amazing?
It's unbelievable. Some people get excited about meeting, famous quarterbacks and sports stars, and you're my superstar. So
it's my pleasure, and I'm glad we can help you.
And if you're ever in upstate New York, we have a big apple orchard and hard cider and cannabis company. You'll have to come up for the tour.
Send me some of your hard cider.
Yeah, absolutely.
Send it to the address here, care of Dr. Deuk. My kids love hard cider. I would love to try your hard cider.
All right, love it.
All right, my friend, enjoy life.
Thank you.
All right, let's get you out of here.